CardioMEMS device is a small device about the size of a grain of rice that gets placed into the patient's lung circulation, and it's a device that helps monitor the pressures in the lungs, non-invasively, meaning without having to have an invasive procedure to measure it directly, like a right heart catheterization. It's a technology that we use in heart failure patients who are having symptoms and who have been hospitalized over the course of the last year to help keep them at home. Typically, patients have a pillow. They lay on the pillow automatically monitors the pressure in the lungs, transmits it to the software, and our clinic follows it.
Well, I was in the hospital 6 times in 8 months. And we went from having a pacemaker put in to having the cardiac MEMS. Then I had a couple experimental surgeries. I was short of breath. I had all kinds of, they thought I had COPD, and it turned out that it was all due to this artery being opened up. And the cardiac department of St. Agnes did a fantastic job.
The placement starts in the groin. So we go into a vein on the right side of the circulation in the groin. We go up the vein through the right side of the heart and into the pulmonary circulation. And we place it into the pulmonary artery. Once the device is implanted, calibrated, you do go through a little bit of a orientation process with the manufacturer to make sure that you understand the pillow and how to set it up. You do have to be on antiplatelets or medications like aspirin or clopidogrel for a certain period of time, but you go home the same day. Just some restrictions to avoid any bleeding at the access site. So the idea is patients with heart failure can monitor their weights on a daily basis, and we try to make changes to their diuretics based on their weights. That way, if their weight's starting to climb, we suspect that there's some fluid accumulation, we may adjust their diuretics. There's a lot of assumptions with increases in weight, and with this device, we measure the exact pressure in the lungs. We have a set target in the software after which it alarms, and if the patients go above that target for a certain number of days and they're sustained, then we're able to call them and make a change. We have specific protocols depending on how high above the target you are and how low above the target you are, so that we can adjust medications up if we need to, we can adjust them down if we need to make sure that we avoid that next hospitalization.
I feel a little bit better every day. I think I get a little stronger every day. Sometimes I overdo it on the treadmill, but basically for the condition I was in compared to now, there's no comparison. It gives you a whole sense of new security of how you're feeling and that somebody's got you backed up.
So I think the biggest benefit is really the not having another admission. It's cumbersome for anybody to be admitted to the hospital. And so if we can catch those patients before, when they're on the uptrend of gathering fluid, and take care of it with oral medications that they may already have at home, preventing that hospitalization, I think that's really the biggest benefit of this device. And so here at the SSM Health Michels Heart and Vascular Center, we continue to analyze the procedures that are out there and try to introduce them if we think that it can significantly improve the outcomes of our community and our patients. This is just one example of the many procedures we offer locally so that patients can receive care close to home.